All right. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome, everyone. I'm really happy that you're here with us today. Today's conversation is a special one for me because I'm joined by not just an incredible innovator, but also a dear friend, Hamid Kayode Alabi. Hamid is a social entrepreneur whose work has impacted thousands of young people through education, leadership, and technology. He is the founder of the Kayode Alabi Leadership and Career Initiative and the mind behind platforms like Skill2Rural and Rafiki, which are expanding access to skills and opportunities in really meaningful ways. But beyond all of that, what I really appreciate about Hamid is how deeply he thinks about impact, about people, systems, and what it really takes to create change that lasts. This marks the first podcast conversation that we have. And in today's conversation, I'm honored to have Hamid as my first guest. We will talk about his journey, the work he's building, and how all of this connects to medicine and healthcare, especially for those of us thinking about impact beyond the hospital walls. Hamid, I'm so happy to have you here today.
Yeah, no,
Thank you
it's
so
great.
much for your time.
Yeah, it's great to be here, Somaya, and I'm looking forward
Thank
to
you.
sharing my thoughts. And thanks for introducing me beautifully as well. It's great when your friend actually introduces you. You feel that goosebumps within you, and yeah, it's great to be here and looking forward
Least we
to.
can do. This is well deserved. The least we can say, Hamid, about you. Alrighty. So, Hamid, for people who may not know you well, how would you introduce yourself in your own words today?
Yeah, I think one of the things that I struggle with is actually introducing myself. And I know I've done different things or multiple things, but one of the ways that I like to introduce myself is through my ideals. And because most of the time people want to follow you because of what you have done, but not because of what you embody. And when I think about my ideals, I'm thinking about, I don't want to be everything. I don't want to own everything. I don't want the world to fall at my feet. I don't want to be like the best person in the world or any kind of thing like that. I just want to ensure that I help one young person cross or one child cross, one young person who have lost either one or two of their parents, a young person who is like in a displaced camps, one young person in a refugee camp, one young person who is struggling, to just navigate life and I'm just there for them and provide them the necessary education, skills, and opportunities for them to change their circumstances. So I might be able to inspire a million or one, but what I'm very sure of is that I will die trying doing this work. So whenever people ask me, Ahmed, introduce yourself, I know it's very easy to say, oh, you're a TEDx speaker, you've written books, you've done poems and all of those things, but I think the best way to, introduce myself is to talk about, my ideal, and why I do what I do. So I think that's my ideal in a nutshell. But when we look at it more broadly, I can share a bit of my story. So I was born and raised in one of the largest floating slums in Africa, Makoko, Nigeria. I lost my mom when I was 7, and my dad became unemployed at the same time. I stayed out of school for academic term, and it was the same for my younger brother, who stayed out of school for academic year until I attended a program for vulnerable children when I was 14. This program introduced me to leadership and self-esteem, and I could still recall the definition of self-esteem then, from this program, that self-esteem is the way you see yourself and the way you see the world and the way you handle yourself and the way you handle the world. And I'm like, I started seeing myself as somebody who can start doing something within my community that despite all of the circumstances, what can I start doing within my community? And that was why I started teaching when I was 15, in a basic rural school in the community that I was living in. And that was how I started, the Kayode Alabi Leadership and Career Initiative to help young people of my kind, to develop the skills needed to navigate their own world and their own life. And all of the, initiatives that I've created like Rafiki AI, which is the African first generative AI career advisor and counsel of underserved and displaced young people, or Skill2Rural Bootcamp, where these young people identify problems within their communities and co-create solutions to them using design thinking. Yeah, that's my story. But I also think that for a very, very long time, I used to think that my purpose was my story, but it wasn't. I realized that my grief was actually my purpose. That it was through my grief that I found, the courage to do this work that I'm doing today. that if I hadn't lost my mom, I don't think I would have gone to like do the things that I've done. So, so by, working hard, to be the best student in my university days, by just trying to do things, by just trying to create things, I didn't know that that was one of the ways for me to live my grief. And it took me only 23 years to later understand that it wasn't my story, wasn't my purpose, it was my grief. That it was through my grief that I found my purpose, and it was through the grief that I started creating, and it was through the grief that I found meaning, to do the work, that I do today. So, yeah, so I think, when I think about my work and I think about my purpose, I think of the five-letter word, grief. So, but yeah, it's that's me briefly, and yeah, looking forward to sharing more of my own journey and experience and story as well.
Yeah, thank you so much for joining. And um, may Allah, inshallah, ya Rabbi, grant paradise to your mom, of course. It's definitely hard to lose a family member, yet be it a parent, of course, at such a young age. But mashallah, this speaks, of course, of how you took grief in a whole different path. And this really is an inspiration to us all, by the way. So, those of us listening, this tells you a lot that you can always turn sad events in your life into really a motivation. It is a fuel where you can hopefully switch that into success that even those that you've lost, I'm sure, would be proud of for sure if they're here today. So kudos to you, mashallah, and keep at it. This is an inspiration to us all. And you already touched base actually on the introductory questions that I had for you, which actually included the key experiences really that shaped who you are and the work you do now. And talk a little bit about the few milestones, maybe, or achievements that stand out to you. Not necessarily professionally only, but maybe personally meaningful ones to you.
Yeah. When I think about, my achievements, again, I struggle to talk about the numbers because, it's very, very easy for you to lose yourself in the numbers, that you don't get into the actual story. And I think when I think about a story, I think about a story of a young woman, whom I met, her name is Miriam. And I met her in 2019, January, I can remember. No, 2018 January. Yeah, I think it's 2018. Yeah, it was 2018 we had that program. It was January 2018. Yeah, I remember. And then, we went to their school for like a career session, where we are doing like career seminars and career talks, and helping these young people to find their strength and interest. And I think I shared my story at that program. And then she caught like the fire of like, the things that she wanted to do. And at the end of that program, I would share like my phone number with the young people, be like, if you have any question, or I will share even my Facebook. If you have any question, just come to my DM and ask, and then I would answer you. And this girl actually came to my DM and then, was asking question about how, she was inspired by my story and how she wanted to work in the health sector. Actually, she wanted to, work in the health sector at the time, and she didn't know how to go about it. And we chatted here and there. And when she kind of like graduated from like high school or secondary school, um, she was struggling to get into tertiary institution, and then she came back to me, and then she said, "Oh, I've been told by my aunts that I am not brilliant enough, and I shouldn't go further. That my parent didn't go further to higher education, so I should go do handwork." Which, I mean, it's not bad for people to do that, but I was just like, so we had the conversation, and I told her, I made a statement that day. I'm like, and she said something really powerful. She said, I might not be the best person, but I also know that I'm not average. And I was like, yeah, I'm with you. And I said, if in any way you get into an higher education institution and you need to navigate that path and you need to get in, just let me know. And then she found her way to get into the College of Health in Lagos. And but she doesn't have the money to pay. Our parents also could not afford. So I did a fundraiser then. I was doing my master's then in Edinburgh. I think that was 2021. So I did a fundraiser, raise money for her and another young woman as well. There were two young women I raised money for back in the days. And we were able to pay her school fees, got her in and everything. And then she started in the College of Health. And now
Where were you at the time, Hamid, and where was she?
she was in Nigeria. So as of
So you
then,
were in the UK and she was in Nigeria, and you managed to fundraise money to
yeah.
cover her scholarship?
Yeah, school fees.
Wow, that's amazing.
So what we did was that we started covering our school fees all through the journey. So
MashaAllah. Wow.
from national diploma to higher national diploma, we covered every single thing along the way. I've been to our campus before. She
Mhm.
showed me a project. She was working on poliomyelitis and she was studying orthotics and prosthetics. And now she finished the higher national diploma already, graduated, even got like a digital analytics scholarship to learn digital analytics.
Wow.
And she is now like doing things for herself. I could see like how she has improved the confidence in her speaking, the confidence in the things she does. And I could recall there was a day she saw like about three young people were out of school. And then she reached out to me, Ahmed, there are three young people who are out of school. I know you were a jigsaw in my own puzzle. Could you be a jigsaw in the puzzle of these kids as well? And we got all these three kids as well back into school through our support and through our help. And she's now a volunteer in the organization. She does a lot of change making work because she's been just like, I've been supported. I would also like to pay it forward to other people as well. And very soon she'll be graduating and she'll be going for the National Youth Service program, which all Nigerian graduates go for. And it's so interesting to see that she wants to also set up her own kind of like, center for, orthotics and, prosthetics as well. And she's gotten like, bigger dreams. So when I think about, a success story or an achievement, I know it's very easy to say that, oh, this work have reached tens of thousands of people or hundreds of thousands of people. But I look at the story of this young woman that sometimes, when we think about change is not just, that one-off support. It's actually identifying people who might be struggling within, those communities and working with them along the journey and holding their hands through that journey as well. So for me, it's like supporting this young woman through the journey, being there to have conversation, being there to talk. Sometimes the refuge that people need is are people, right? Especially when people know that there's no home to actually return to at times. So we need to like be there for those people along the journey. So I would say that when I think about, the achievements, you could talk about building AI and all of those things. They're all good, but there's something about personal support and consistent support over time that many people who changed their circumstances was because there was somebody who were there for a very long period of time. That's how they get to change their own circumstances. So yeah, so I think that's one of my view of change, that when we think of change, it's not just about scaling up in numbers, it's also about scaling deep. It's about like providing constant support for a very long period of time.
Wow, this is an amazing story, Hamid, and great work. And this is extremely important what you're saying, and actually this is an important reason why I thought we need to hear from people that have this kind of expertise as yourself, because I feel like, for example, I come from the Arab world and we are not taught these concepts early on. This is something you either do on your own or you just don't. And the easier thing is that just you don't, because it doesn't require any work. Whereas if you do, exactly like you said, I'm pretty sure it takes a lot of work, whether it's crowdfunding, the follow up, consistent work throughout the years. It's a longitudinal work. It is just long term thing that doesn't stop. And I'm kind of swaying here to another point that, even though I haven't actually thought of asking while I was preparing for the talk today, but I think it's extremely important to talk about, which is, the current events, and most recent of which, and still ongoing, unfortunately, is, the genocide in Gaza. The thing that came up during the genocide, Hamid, was a lot of people kept asking themselves and each other, like, how can I help? How can I help? What do I do? How do I do this? And I think, besides the feeling of hopelessness that unfortunately hit everybody and majority of the people, which is really negative because it made people just elect to believe that they can't do anything to change anything, which is completely wrong. I mean, I think everyone has the ability to do something in some sort of capacity, right? But this kind of stems into the core principle of social entrepreneurship and innovation. I think had we had a mindset of like that, we might have been maybe in a better place. May not have been able to change everything, unfortunately, for the people in Gaza, but at least would have been able to alleviate some of the pain or contribute something. So, if you don't mind me, if you were to contrast through your work, let's say between your experiences, let's say doing these scholarships and helping people right in Nigeria and try to implement this into the Gaza. What do you
Yeah.
think the steps would have been if you were in that position? Like what steps would you have taken in order
Mm,
to attempt to do that in the context of Gaza? Like what advice would you give us? For example, if we were to consult with you, let's say you're our consultant and you have that expertise and we are
mm,
asking you like, hey, I want to implement something like that, like let's say scholarships, let's say, and I want to
mm.
do this in the context of Gaza, knowing all of the limitations and challenges, unfortunately. So if you were to advise us, what advice would you have for us from your experience and how to carry that type of work you've done in Nigeria and try to translate it elsewhere, such as in the case of Gaza, which I believe is probably the most challenging, but I kind of really want to hear your thoughts on that.
Yeah. Hmm. I think
I
this is
know it's hard.
it's a difficult one because,
Yeah, yeah.
you can't imagine, what people are going through at the moment in Gaza. I've watched a lot of videos. I've read a lot of stuff. Most time I've not really spoken about it, but it's been going. I've been thinking deeply about what is happening there. And sometimes when you look at the situation, you see a 11-year-old who is carrying stretchers and picking up the dead bodies
Mm,
on the road, and you're thinking, what is going on in that 11-year-old mind, right? At that moment, that 11-year-old should be in school at the moment somewhere, and then you look at all of these, situation, all of these issues and the complexities of those situations, the complexities of, where do kids actually learn? What can they do? And I understand the place of activism. I understand the place of advocacy. I understand the place of, we, actually like putting pressure, on the people who are in power, especially the people who are committing these atrocities. I understand, the place of that. And I think we need to do more of that. And I think that we need to keep raising our voices for that. But I also think that, sometimes these people or this group of people want to make us powerless as well. Don't want us to do anything,
right,
so the
right,
so-called media, want to show you all of the horrible things, which is true. We need to see them, but that state could put you in a state of powerlessness that, with all of the states and everything happening in the world, oh gosh, I'm sad. And then you're sleeping every day, you're carrying a heavy heart, and you're like just struggling to actually breathe or even live, even though you're alive. And one of the ways that I started thinking about this is like, how do we respond to this in a way that is, quiet but still powerful? And one of the things I started doing was that, I'll create, maybe creation is the way to respond to this crisis. Maybe creation is the way to, question the world. Maybe creation, is the way to challenge the world. Maybe creation is a form of quiet rebellion, in a way that you respond to the world in a way that is meaningful. So I would encourage first is that maybe as people also contribute and donate, maybe people should also now start thinking about creation. And the moment you shift your mind into creation, there's something powerful about creation as a means, as a response to war, as a response to death, as a response to genocide. And I'm thinking of like, for example, I built Rafiki AI, for example, right? And it's on WhatsApp. It's like a generative AI career advisor and counselor for underserved and displaced young people. So, and the reason why I built it on WhatsApp is because for anyone with like the most little internet,
mm,
so they're able to access it, right? And I could recall that one day I noticed that there was a user who used it from Yemen. And that brought like, I think when I saw that we had a user from Yemen, I actually walked out. Like I was going for a walk and I was just reflecting. Like I was going for a walk and I kept reflecting and I'm like, I don't know what this person is going through. I don't know what their circumstances are. I don't know whether they're in a camp or something. I don't know wherever they are. But maybe they found out too. And then they've decided to ask a question. And that question that they've asked has changed something for them. right? Maybe that question that they've asked has given them something new to believe in, and I think that's a way of responding to the world in a way that is meaningful. So what if, we created technology, right? Whatever form of technology, whatever form in a way that it responds to a current situation, what if we create something that gives people something new to believe in, right? And I think, that's a good use case of technology to be like, you're responding to the refugee crisis, you're responding to war and everything without actually like going to war or fighting.
Right,
No,
right.
that's a way or a form of a quiet rebellion, and that's an alternative as well, right? So that's an alternative to response to the world. Another thing we did, right? I was reflecting recently that sometimes the environment we are in reflects the kind of the thing we do as a kid, right? Um, when I was young, I see a lot of bus drivers and I would try to want to mirror that. I see a lot of, the things I was creating were the things that I saw in my environment. They weren't nothing else, right? And I was looking at, again, I saw a video of children who were trying to, they were creating stretchers, with sticks, and they were like building things and they were like creating a doll of a dead person. And then they created a doll of a dead person, and then in Gaza, and then they put that on the stretcher and they were carrying. And they were like, we're Matthias, right? We're carrying. And you look at, children sometimes don't have expression, but you could see the expression of what they are trying to do. They're trying to like show their reality of what they are going through in their environment. And the genesis or the basis of Skill2Rural Boot Camp is that how do these young people actually co-create solutions to their own problems? Maybe co-creating solution or creating in any form, whether art or creation, could be a way of response or a way of also therapy, because we did this with the displaced camp. I know the case is totally different, but in Nigeria, we went to like the camps in Maduguri, which is where Boko Haram, invaded. And we, taught these young people design thinking and how to create solutions to their own problems.
Oh, so,
And
so the people in displaced camps were
yeah,
doing creation work?
yeah, they were creating
Oh,
co-creative solutions to their own problems. So
oh,
they
and how was their reaction? Because they're probably overwhelmed, and obviously, most people in those areas would rather take care of like the basic needs, right? Like finding
yeah,
food and finding shelter. And then
those,
you
those,
come in and you tell them, how about we create and design solutions? How, I'm just curious to know, how was their really response to that?
so the food as well is part of the programming. So it's all together, right? You also like arrange for the 3 square meals and everything, and you
Oh,
know, bring them into a space, to create,
oh, okay.
and you kind of like, it's all encompassing. It's not because again, when we think about our programs, we think about communities, we think about different use cases, right? And one of the things we started seeing was that people were actually creating things that reflect their traumatic experience.
Hmm. Oh,
Kids
that's
were
true. Hmm.
creating things that shows their reality. And when they started reflecting after the creation process and they were talking about what they've created, they were like, we used to think that we cannot do anything. We used to think that we don't have a power. We used to think that we are powerless. But this sense of creation gave us a sense of power, that we could actually start reconstructing our society. And one of the, young girl, they said, in Hausa, it's called Gida. Yeah, Gida Sakim. I can't remember the word exactly. But it's like, yeah, Gida Mudadimo. I can't remember. I think it's something like that. Gida Mudadimo. I can't remember exact word, but
What
it's
does that
like,
mean?
it's
Hmm.
in Hausa, it's like our home is our pleasure, and they were like, reconstructing their homes, they were like creating mobile clinics, They were, so that women who get pregnant in that area in camps can receive treatment, because one of the girls have seen women die because they could not receive treatment, and see children die at birth, and see, the women also die. And it was like, okay, what if they receive treatment through a mobile, clinic, or a mobile emergency bus? And they were like developing the mobile emergency bus based off their own experiences. And and then you think of, like, what if, again, I don't know the situation at the moment, but if what if the kids, who are already like creating structures to reflect their own experience, what if they start thinking, what if, they get all the support, therapeutic support they need? And that aspect of therapy also revolves around creation and around response, to their own problems. So what if, those who are like trying to find education, we finding new ways of, tele-education, of responding to that, which I think you've also been doing a lot of work on. What if we, go back to radio, to deliver, form of education? What if we go back to new ways of recording, new ways of like sending or delivering lessons, new ways of assessments, and new ways of, making sure that people can actually learn while still in that moment of distress? But I also like acknowledge that, what do you also learn when there's bomb beside you somewhere, or when you're like listening to the horror of the people dying beside you, or you're carrying the horror of the voices of the people who have died? So I don't think I qualify, to be honest, and I don't think I have an answer, to even say that, this is the kind of solution,
Mm,
that we can create for the people who are living there. But I know for sure, that, those young people one day would rise to be the one to reconstruct their home. And I hope that one day the world will be safe enough for them to be able to do so.
sure.
I hope that one day they would have a space to call their space and their place home, and that home becomes refuge, and then open up a pathway for creation.
Sure.
They don't struggle for their basic necessities to create and to do things. So, but I think that we can try. I think that what we can do is to try. What we can do is to show up, because sometimes the glimpse of hope is shown in the little things that we do. And then we,
Mm,
how do we deliver these lessons? How do we create leverage AI on WhatsApp? How do we create, an education that powers this? How do we create, resource quickly that we can send? How do we, use Gen AI videos, animations, and everything to power lessons? Like, we can try. We can show up in many ways, whilst also like addressing the trauma, addressing basic needs, and addressing all of the other things, because we have to think of it in a wholesome way, rather than thinking that we are going to go there and be the savior of Gaza, when the people who are there can be the ones who would end up reconstructing their society. We can only try, but I think, it's the people who live in that community,
mm.
who have seen what it means to go through a war, and that challenge is, I think they will be the one to co-create a solution, and we could only be there to support and help and provide what we can. I don't know if I've answered your question, because I don't think I feel, qualified, and, to answer that question, but um, I don't know.
I think it's an important question to ask, and I think it's important to think about it, right? Whether we're qualified to answer it or not. It became really the question of the hour, right? And no one want no. I guess the responsibility. There was a lot of fear about that responsibility, but I think the key message that I'm understanding from you now, Hamid, is, you know, empower the people. So the people impacted by disasters, such as the case in Gaza, the key message is empower them, make them the center of the creation, right? They will co-create, they will tell you the need that they want, and you just support them. I think I totally agree with you. I think that is the most important thing, rather than imposing on them any kind of line of work or initiatives that we think they need. No, no, I think we should have them design, create, or co-create, and we provide them all the resources and support that we can provide them. Is that correct, what I understood from you?
It's
Okay,
because the world always like to be
that makes sense for sure.
uh, the words always like to be like, oh, we are the savior, and people like to feel good about giving. And oh, I've just done this, and you again. I don't want to mention anybody, but but people like to feel good about like, oh, we are doing this, we are giving this, we are doing
Right,
all of it, But the true revolution or true change comes from the people themselves. It's not by somebody who says, "Oh, I've given this, I've donated this to feel good." It's about like how do you actually like ensure that people's dignity remains the same. People feel
right.
that they're part of like a particular change process. That you don't give people something and they feel like to hell with what you've given us. Take it back, right?
Exactly,
Because
exactly.
when it feels, when things is not true, and when you're given something and you can feel in your heart that it's not true, and you
Yeah.
can feel in your heart that it's not true giving. So I think, even when we think about giving, what ways are we giving? In what ways are we retaining the dignity? Because that the
Mm,
process will tell you, they say like, the process justify or the outcomes rather, or the way people respond justify the means, at which something is being delivered, right? And people can easily feel, people can connect, to somebody who is real or not.
right.
And then, so yeah, I feel that if you really want to create that change, we really need to actually co-create and support, and we need to create something that respond, to the world in a way that is unique, in a way that solves really deep problems. And like I said, we have to try because it's only when we try that we can start seeing the glimpse of light of the change we
Mm,
want to. If you don't try, you don't get to see. If you don't try,
absolutely,
you get to see the possibilities of what is possible. So it's only
absolutely.
when you try something that you now start seeing the light, you start seeing the possibilities, you start seeing the opportunity for you to bring other people to be part of the story, right? And we can see that, with some of the things that, now people know about the reality of what is happening, right? It was one people shedding the light, people talking, and then then people joining in that movement, right? So yeah, so I would say that, we can try to create somewhere. And I think, maybe the diaspora also have a role to play, people who are living in diaspora, who are also from Gaza, again, how do everybody actually come together,
Right.
to create this solution, because the people who are from there, is like you could feel the connection, you can feel the pain, it's directly to you. So who is the person to best create solution, if not the first person feeling the pain point as well?
Mhm. Absolutely. And that I did feel the despair, right? I did feel the hopelessness, and I was even told many many times that there's basically nothing we can do.
Hmm.
And I refuse to believe that, and I still refuse to believe that, to be honest. And imagine if you are in Gaza right now and people are telling each other from the outside that there's nothing they can do for you. I mean, imagine they're already like locked in and alone, and imagine if that also is being said and they can hear you say these things, how even worse they would feel, right? And that is in no way gonna make them uh,
Hmm.
continue their steadfastness and continue to battle for their lives, right, and continue to try to survive. In no means is that empowering if you keep saying there's nothing I can do for you. That is the total opposite. It is actually adds to the destruction of the people. So we should always be hopeful, but also not just by words, but actually always try. And I'd rather keep trying and fail than not try at all. I think the not trying at all is the real failure, and I think you also agree with me on that. We've talked about this a lot in our conversations. That I'd rather continue trying and continue failing than not trying at all. And I think people appreciate that, by the way. They see you. They see you, they see the efforts you make, and they appreciate you. And they appreciate everyone are really, you're responsible for the work. You're not responsible for the outcome. And
Hmm.
I agree with that. I'm a believer of that. Like I will do the work, right? And I always hope for the best and I hope for the best outcome. if we get there, then alhamdulillah, I'm gonna keep going. If not, then we'll improve it or find another solution and keep going, and so on and so forth. That
Mm.
actually brings me to a very important point. So I want our audiences and everyone listening, I want you to know that Hamid actually has already implemented something that could be probably replicated, by the way, in areas where there are wars, disasters, conflicts, and so on. Although I don't know if Hamid thought about that when he initially made it. I don't know. But I want you, Hamid, to speak very briefly, if you could, about Rafiki, because I actually even called you just to talk about Rafiki and how I think amazing this platform is. And by the way, I actually used it myself, and it's working. It actually gave me great advice and consultation about my career. I was like mind blown. And by the way, funny fact, I actually asked it something about my past, and I asked it about what shall I do in the future, and it
Oh,
correctly predicted what I would do. So I kudos to you for this amazing work. I mean, even that platform could give me the right answer, in my opinion, at least in my situation, whatever questions I gave it, it was very close to what was happening to me in the present time. So this tells me about the authenticity of the platform. But I want you guys all to know, by the way, that actually Hamid doesn't even have a computer science background. He is not a technology major. He has not studied, by the way, like me, computer science. We haven't. So I want you to, this is important to highlight, not as a defect, actually the opposite. This is it's a technology based intervention that came out of someone that doesn't have a background in technology. So I want you all to hear about this from Hamid. What is this platform? What does this do? Because I think such an idea is fantastic and could be implemented in low resource settings,
yeah.
Gaza included. So I want to talk about it briefly with you, Hamid. Can you tell us about Rafiki? What problem is it solving, and what is this kind of technology, and how do you think it's evolving, and what's going to happen in the future?
Yeah, I think I would share a bit of a background, before like I talk about the technology in itself, because
Yes.
I think most of the time, for every technology that we create, especially when it comes to social impact, I think
Mm.
we have to connect it to the lived realities of the people because the technology that end up scaling and the technology that doesn't go anywhere is because it doesn't get connected to the reality of the people, right? So, and I think, and that's why we need more people with lived experience to start building technology and start building solution because you can then, situate your own lived experience and your own experiences, into, this technology or into the solution. And there are many other people who might be going through the same and they can connect and relate. So the background around Rafiki was that, we used to do like a career seminar, career talk, and we do like one-to-one career chats with kids, in rural communities and underserved communities. And the first very career talk we had, children had loads of questions. Like they were like asking me a lot of questions. And I'm like, oh, there were some I could answer, there were some I couldn't, but I still answered them anyways based off what I know. And I left that place and I started watching a lot of TED Talk on career, like I was watching all the TED Talk I can see on career related, intervention. And I
So
remember,
sorry to interrupt you. I just want to clarify because I want to also walk us through the steps and learn from you, Hamid. So you intentionally went to camps and met children and solicited from them if they have any
so,
questions about
so, so,
career?
so, so it was like we used to do like a career seminar in schools in underserved communities. So,
Wow.
but at the end of the talk, we also do like one-to-one career chats, group career chats. People would come, so they would ask questions, and
Oh,
then we're supposed to give them advice.
wow.
So
Okay. Okay.
we give them advice based off the question that they've asked. So, but I also noticed that my own knowledge was limited, right, around the career and everything. So I would give advice based on what I know already as an adult. But then I started like, if I need to like, give even more correct advice, I need to know more. So I started like reading more about career, watching TED Talk on careers, like, I would go online, watch everything. And then in between, based off the conversation, I started developing a model myself. So I developed a model called ISLP. So I stand for interest, S stand for strength, L stand for limitation, and P stands for purpose. Because I understood that for people to be able to like advance in their career, it has to be something interesting to them. So how do they find their interest? What do they like talking about? What do their friends say that they love talking about? What do people tell them they are good at? What is their strength? What can they actually do based off their own background, based off their environments, based off their experiences? And then what is holding them back to actually be able to develop their interest and strengths is the limitation. And that limitation could be anything. It could be lack of education. It could be whatever different things that is happening at the moment in their lives. It could be poverty. It could be different things, right? It could be like lack of parental, knowledge and like it could be different things. And then what can they do to change the world with their interests and strengths? And this is where the purpose comes from. So, and we then start asking all of these key questions then manually. And then based off those questions, we would then say, okay, maybe you should try this. It's a suggestion. Maybe you should try this. Maybe if somebody talks about them loving arts and then also loving medicine, we start talking about like art in medicine, something like that. So we start like, figuring out those unconventional career pathways, that are not like, direct as well. So we were doing that manually. And we also published that in a book called Career Wisdom. And then we wrote stories, we gave stories and examples of different people who have moved in that path as well. Then when generative AI came to be, and with the launch of ChatGPT and Claude and all of these Gen AI tools that started coming to play, I was like, I started using those tools myself, and I was thinking about the children I was working with. And I was like, what if we create a Gen AI platform using this ISLP model to then provide career advice to people who we might not see in person,
Oh, wow.
or to people who might
And
not.
were you thinking, I want it to be not using the internet free, for example? Like, were you thinking that
Yeah, yeah,
also?
yeah. So I was doing
Yeah,
all
you
of
were
so.
thinking that. Wow.
So this was the first thinking first, and I'm like, okay, if this group of people wants to use it, which platform could they go to? I was like, oh, if we build a app, logging in everything, what of people without phones? I was just thinking of multiple dimensions. I'm like, okay, I think WhatsApp, because for every technology, in Africa, the entry point to technology in Africa, for example, it's social media. So it's like the first thing people started using Facebook, Messenger, WhatsApp, those are the things that people were using. And with a list of data, you could use those platforms. With a little Android phone, old Android phone with little WhatsApp, it means that you can chat. So what if we build a solution in WhatsApp that people are already exchanging almost 16 million messages per day in Nigeria, for example, every day on WhatsApp? So what if I build something on that already?
Mhm.
Existing platform, right?
Mhm.
So that was how we kind of like started exploring the model. I developed the first prototype myself. So I
Wow.
was like going on ChatGPT, I was browsing, I was writing things. I was like, okay, try
Wow.
this, try that, and I found myself in landbooks.io where I was trying to build a prototype and I would write my question, I would write my answers, I would write, all of those questions that we used to ask the kids. I started plugging them in.
Wow.
And then I was providing the answer, but the answers were predictive. So I did my testing on WhatsApp myself.
Good,
And
good,
it
good.
seems,
Makes
predictive. But I
sense.
said, oh, what if I want to make it generative AI? What if I want it to be natural? And then they were like, oh, you have to get an API. I got an API key.
Mhm.
I was like, oh, you need to create a webhook. You need to code. And I'm like, okay, this is where my knowledge is limited. I can't code.
Right.
So what I did was that I screen recorded everything that I've done, every single thing that I've done, every single process that I've taken. I screen recorded everything.
Wow.
And then I screen recorded everything and I went to my develop. I went to like a developer, like now this is an expert who can actually
Right.
be. And I'm like, okay, this is the use cases I've developed. I want it to be powered by generative AI. Can you do it? I'm like, yeah,
Oh,
it's possible. We can. And then we started having conversation, we started discussing. And then within 30 minutes, they got it. And
wow.
then they went on and then, we built and then we had our first prototype. It wasn't interactive. I'm like, this is not interactive. I want to create something that is interactive based on this model. So we built one that is now interactive and, we tested and keep, iterating. And that's what people now have today as Rafiki AI on WhatsApp, right? And then, children, young people started using it. In fact, There was a young person who was supposed to do a presentation recently, and she was like scared and anxious. And she went to Rafiki and she got the answer to be like, this is how to prepare for your presentation, and this is like a young woman from an underserved community in a, in a slum, in a slum community somewhere. Maybe her parents could not provide advice because they also don't have the knowledge. Maybe the person does not have an uncle who work in the bank. Maybe they are not from privileged position. But now they're able to ask a tool to help them, to develop their presentation skills. And we think, there are so many things that we take for granted that we think that, because, you have an uncle who can support you, who can prepare you for some certain things. For some of those young people, they don't have anybody within their community who can support them. But they understand that their parents has gotten an Android phone somewhere. There's an uncle in the community who has an Android phone that they can borrow, and then they can use Rafiki through that. And and that's the way we kind of like build it. And mashallah, it has exchanged over 92,000 messages already,
Mashallah.
answered over 42,000 career related queries, currently be using up to 60 countries at the moment. And it's good to see that people are using it, and has maybe over 10,300 users at the moment, so it's great to see, the reach, of people who are using from different countries, from Mexico to Kenya to Uganda to Pakistan, to different
Amazing.
parts of the world. And
So it's
and
multilingual. Is it multilingual?
yeah, so you could even chat in Arabic, you could
Oh,
say
nice. Amazing. Wow.
you could chat in Swahili, you could chat in the local languages in Nigeria, uh,
Wow.
even Spanish and
Can
so
you
on.
chat with it offline without internet?
So that's the only thing we haven't been able to build. And I was thinking, but you could drop a message offline, and
Oh,
then
good.
once you connect, he
Oh,
answers.
oh,
So
nice. Nice.
within 24 hour span. So and because again it's powered by generative AI, it requires internet. And to be honest, I think one of the things that I used to think about offline solution. And I'm like, offline solution sometimes is marginalization.
Yeah,
That why would you be saying that you're advocating for offline solution for a group of people when they should be connected to the internet, for
that's
example?
so true. That's so true. But that speaks also to the digital inequity, right?
Oh,
I mean,
exactly. Like,
there
oh,
are still people in the world, unfortunately. I don't have the numbers, but it's a significant percentage of the population on Earth that are actually still not accessing the internet. That is in itself a disaster, actually.
it's all we're creating offline solution for them. I'm like, why?
That's so true. Well, yeah.
Like,
True.
what if they'll actually have a cable and powered? It means that they're powered to even more resource, more technology, more information than the offline tool, because offline tool is pre-trained. It's like
Right.
obviously, it's like predictive.
Mm.
You already have it recorded. You already have it saved somewhere. So it's not internet. It's not something that
That
happens.
is true. That's true. But
No,
the problem is these offline solutions become extremely important, unfortunately, in situations like in Gaza, for
yeah,
example.
yeah, yeah,
You know what I
yeah.
mean? Because the internet got cut off, you know why? And then disasters, right? When natural disasters hit, there's no way you would have the access to the internet. So sad reality is, as much as we do want everyone to have access to the internet, the truth is, disasters on top of which is man-made and natural disasters could actually prevent that. And this is when people go back again to try to innovate offline solutions or like technologies that don't need internet access to
Mm.
mitigate that. So I'm
And,
sure,
and I'm
that's
also thinking that even the so-called internet is human creation.
yeah, that's so true. Yeah, of course,
Yeah,
absolutely,
because if
absolutely.
we say cutting internet, who is
Yeah,
cutting the internet to start with?
that's so true.
Because
That's so true.
now we know the internet stays in the cloud, right? There's a cloud
Mm, mm,
powering internet. They're like big platforms who actually have all of this in the cloud.
so true.
And you can easily just turn it on for different group of people that might not even have access. So if you're saying internet, what does that actually mean in real sense?
Yeah, right. That's so
It,
true.
it is created by somebody, right?
That is true.
That
Absolutely.
then powers,
Mm,
particular space or a particular community. And you could even power without actually being in proximity to the space.
mm, 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 mm. Yeah, yeah.
They are, we now have, all of those
True.
different ways, it's when I started learning about cloud computing, start
Mm,
learning about cloud, the whole cloud infrastructure and everything that you could actually, there are ways, people are powering things. Like, for example,
yeah.
I use a SIM card without even being I can buy a SIM card, a digital SIM card without being somewhere, right? And then I get internet straight up. Like there's a way to it, right? So,
Yeah,
uh,
absolutely.
this,
Because the it became decentralized. That's the whole point of the cloud computing. You're absolutely right. And I think from now on, when disasters hit, people should think of it this way in terms of priorities. Priority is get the people impacted online first. That's what you should do.
And
Give them
yeah,
the access they need. Because you're right, the access is actually the resource is there, the internet is there, right? It's just that you just got disconnected from it from centralized reasons. But then the innovation lies in the fact that priority is get them back, get that access back. And
yeah.
with that access, they get a lot of right resources, right? Like at least vital resources, like, technology based at least. So
Beyond the
I agree.
resources, people also get to now see what is happening as well, right? What is
Yeah,
happening in a situation, what is happening in a particular place. People get to see and read
exactly.
information. It's, you can then use that to, like, advocate. You can use that for activism. You can use that for like different means and different things. So, sometimes when we look at these things and the moment you start looking at politics, geopolitics and everything, you're like, actually, majority of the things in the world are created by human beings. It's like human beings actually, cutting things off. So when people say people don't have access to some certain things, I'm like, that's a human creation, it's a human problem. And one of those is a human problem that seems greedy, that loves power, and many other things that I don't want to, like, but we
Yeah.
know that. And I still advocate for offline solutions still, that I think, there are ways where we can build uh, asynchronous learning, so
Oh,
asynchronous
asynchronous,
learning,
right.
it's like, learning that is already pre-recorded, pre-made, pre-created documents that you can easily just go through and read, and then you can take the quizzes later,
Mm,
or you can, do the interaction later. So we could find a way of like asynchronous learning, powered asynchronous learning through offline technology, where we've uploaded every single thing through the internet, and now people can use it in offline mode or offline use, or a powered, so we could find new ways or new meanings of how to create some of these things or technology. But I have always known that the human mind is actually powerful. And there is nothing that we cannot create for any particular system. It's only that maybe like we say, when we don't try, we don't know the capacity of what we can do. So personally as well, I'm doing a lot of thinking, right?
mm,
And hopefully we can, come up to a point where access to basic needs and resources is no longer a privilege, but
true.
a necessity for everyone. And
Mm.
there's a lot that makes me sad in the world, Sumaya. I you know
We
I
share the same sorrow, trust me. But
love.
I think it's important that we continue to do our best to put the good work, such as yourself, obviously. So, inshallah, that's actually is even a motivator for our conversation today. And I was thinking as I was, we were preparing this, how can we transcend barriers, right? In terms of taking our perspective fields and merging them, intersecting them, and give them hopefully the bigger kind of awareness. Really, awareness is extremely important. This is step one of going at it. So now we talked a little bit about your background, a little bit about your story, experiences, especially, and gave an example, right, of your work on innovation, technology-based innovations, and we heard a little bit about your background also in social entrepreneurship. Now, I want to go on now to the big segment, which is this intersection with medicine and healthcare and systems thinking, I would say, and how the experiences you have could even intersect with our field of work. My first question is a very closed-ended question. I want you to answer yes or no. I know this is weird, but I really want to see what you think.
Yeah.
Doctors are busy. Doctors are very busy. So they cannot have the time and cannot be social entrepreneurs as well. Yes or no?
Oh, that's a difficult one. So I Oh, yeah, you're putting me in a spot somewhere. Yeah, yeah.
This is because I really have always wanted to hear from, people that are
I,
not in the field, what they think of us trying to go into that journey. And you know how it is, Hamid. Doctors are like so
I think,
busy, right? And this is usually what they say is the reason why they don't engage. So,
I think no, and
no. Okay.
I have a reasons for that.
Sounds
And
good. So that tells me is that takes me then to let's talk more about it and how can doctors really make that happen, right? Because I'm sure that there are doctors, physicians that really want to engage in it. Probably the time is a big barrier to them, but I hopefully today's conversation we can talk and navigate that aspect. So if we translate your work into the language of medicine and healthcare systems, what do you think is the equivalent problem you are trying to solve that could translate into our work?
I think we need to go back to the first question you asked me about the yes or no. I think there's a reason why I said no, that I think doctors could be entrepreneurs and or social entrepreneurs. And the reason why I say that is because, with, obviously I feel like first there's a space for expertise first, a deep work first before venturing into the idea of social entrepreneurship, right? So, working, understanding patients, understanding all of those things, I think all of those knowledge could be converted into, a mobile hospital, a digital clinic somewhere, a digital product somewhere, even having your own center somewhere, whatever like solution you want to create, your own deep knowledge and deep core and deep experiences you can then convert that into whatever form of medicine you want to convert it to. And to be honest, there's a lot of now biomedicine, all of those kind of things happening at the moment. And then you can even see, like, for example, as we race towards artificial super intelligence, because there's, the basic AI we know was narrow AI, where AI is good at a particular sector. And then there's AGI, artificial general intelligence, where AI can now do what humans can do and have the capacity for general thinking and general knowledge, right? And the artificial super intelligence is that AI is now very intelligent than human being and also have the capacity for emotions and human interaction and many other things. And also the whole characteristics of artificial super intelligence is where AI start creating medicine, for example. Like you could create medicine in like 30 seconds, to solve a problem such as cancer. But then the question is, will we then get to access those kind of medicine or those kind of treatments or those kind of support where diagnosis that would take ages would take 1 second, right? Because there's an AI tool being built for that. So again, there are multiple different ways where we can integrate like AI into medicine, but that doesn't mean that the doctor works actually goes away. It means that, after the diagnosis, then, the doctor work then now start, which then, you know, relieve, or the doctor becomes the human in the loop who is monitoring things and who is able to understand. So first, the doctors also have to understand how the technology works. So, and how it's moved and how everything, so that they can be the human in the loop. They can be the ones to say, no, this doesn't work, this doesn't work, this would not work. We think this will work, based on their own experiences, right? So I feel that, the first thing is that there's a need for that core knowledge, there's a need of that core basis of knowledge. And I think, with that, it can translate into like other sectors or other system of creation in the health field. So I just wanted to like, answer that first, as that, could, because I feel like, to be honest, we're all entrepreneurs. We're all like, social, and I think all entrepreneurship should be social entrepreneurship instead. Because if it's social entrepreneurship, you know that you're making money, but you're also serving the people. All business should serve people. That's the whole idea around, or the thesis around capitalism, that it should serve people. People should be the center of capitalism, right? And at the end of the day, what happens is that you're selling things for a very low price or a low commodity, and everybody gets benefits. And then wealth is then distributed equally. That's like the whole thesis around it. So again, I'm just thinking more like, how, do we then democratize health in a way that it's not accessible to like the common person, to like the person in displaced camps, to like the person in war zone, how do we create such a, so I think, using the bit knowledge that doctors have, they have a role to play there. So that's one thing I just want to quickly mention, right? And then when we think about my own work and my own experiences, right? When I think about education or when I think about anything that is connected to like public good or anything, because education is the public good, right? Some could argue, things like health is sort of like a public good as well. Like, because health could determine who is rich or who is not. Sometimes you're just you're I have forgotten the quote, but it's like, you're one sickness away from being bankrupt, sometimes, right? And then before you know, everything collapsed, right? So, but then how do we ensure that when somebody is sick, they don't lose everything? So these are the things that we need to start thinking about. What are the ways people can, early signs, early signals, early, days that it's not like, how do we plug that into our phones, for example? We've gotten Rafiki. What if, there's an AI tool that helps people to discover like they've gotten ADHD, for example, or they've, gotten, a sign of autism, from a child, or from birth or from pregnancy, what are the things the mother is feeling? What are the signs and symptoms that they can plug in into an AI solution to help people prepare and to be better prepared for some certain things, right? Because there are some like things that happens that some of the, syndromes, sometimes happens at birth. So what are the signs that doctors have seen and how could they plug in those signs into a solution, for example? And how could they offer that solution, whether for free or at a very low cost of in a different way to people? For example, one of the things we did with Rafiki was to build an extension of Rafiki called Rafiki X where where like people who need high level career support could get more support, upload their CVs, and uses both analytics and generative AI to provide career advice. So it uses the CV to actually guide the conversation. So you read the CV as memory. What if there's a tool that reads your health information as a memory and use that to predict things and predict patterns? And then you can know that, oh, maybe I've gotten a sort of like autoimmune condition somewhere along the line. And maybe this will come as a result at 30 years old or as a result 29-year-old. And then you start connecting all of those pieces and dots together. And then the people who can afford pays for that. And then the money is used to keep it for free for everybody. And through that money, so what we've done in Rafiki is that if you can afford, you can go premium. So you go premium on Rafiki X, and then you then have access to multiple voice notes, multiple document upload. But what happens is that the money you're paying, this is like a solidarity-based model, right? The money you're paying ensure that the chat is unlimited for everyone. So at least everyone has access to that free chat. And the money you're paying makes sure that the WhatsApp version is also free for displaced and underserved young people.
Oh, that's fantastic. That's a great model. Yeah.
And then we are thinking about health as well, right? When we are thinking about the basis of even insurance to start with, that's the whole purpose of insurance, right? Insurance, is that everybody contributes to a pot, and those who know the health most actually get the benefits. So everybody contributes to a pot of fund. Those who need the diagnosis get the benefits, whilst you are also able to navigate your own health as well. So again, it's like, yeah, I don't know if I've answered your question, Sumaya, but I'm
You
just
have actually, no, you have, and I think obviously I am a strong supporter of doctors, going beyond the clinical duty and thinking more of community-based services. To be honest, I think doctors should not confine themselves to hospital walls and get out there and engage with the population in a humanly way, and a very intimate way, really. That gets us closer to the community, more beneficial, honestly, even if you want to serve the community in non-directly medical ways. In one way or another, I'm sure you will improve their health, even if you don't think it's direct, meaning it's not like you're providing a medication per se, but you're probably addressing, let's say, a social determinant of health, like you're providing food or you're trying to give them access to internet, right? Something, even if you think it's small, it is definitely contributing to the bigger aspects of health, no matter what. And at the same time, you are regaining the public's trust in the doctors. This is something that is very important. We need that. We need physicians and scientists to go out there and engage more with the community. And social entrepreneurship is actually one of them. And the nice thing about it, it's a longitudinal, long-term commitment. It's something you would continuously do. It's a line of work. It's a calling that you would continue to do. Now, you mentioned the AI and generative AI. In the healthcare field, you would be surprised to know that we have not 100% embraced that technology yet. There's actually a
Mm,
lot of fear, especially in healthcare field, against AI and generative AI for, understandable reasons, but that at the same time also puts us behind so many other
mm,
industries that have already adapted, right? AI,
mm,
data security fears, confidentiality fears. This is one legitimate fear, but there's also this hype on social media everywhere that, oh my God, AI could actually take over the doctors' jobs, so they could
mm,
threaten doctors and make
mm.
replace them essentially. And you mentioned already that you can integrate AI into your work. You didn't say the word without replacing you, but you said that you can engage it and you still need to be there as the human power of
Yeah.
controlling it and leading it. You are not going to be replaced, at least I was indirectly kind of indicating that. So now that you've engaged with AI yourself now, Hamid, for years now, can you tell us, do you think it's going to replace us? And if it is or not, can you share with us from your experience? I heard from you the advantages, but I really want to know from you, have there been any real threats as you were engaging with AI in the line of work that you've been doing?
Uh, I think, when you were talking, I had further reflections, that I was just like writing on my table here with imaginary table with nothing written on it. So I was thinking, there's a question around ethics, right? Who gets to own this knowledge? Who gets to own, all of these experiences that the doctors have built over the years, learning and doing all of those things and doing all of this work. Who gets to own that? Which platform are we using to build that solution? Who gets to own, what that means? So I think the question is first, who gets to own, right? Because I think it's an important question to answer that because every knowledge that AI has been built upon is a knowledge of somebody, it's a knowledge of research that has been done, it's a knowledge of, so it's like there's something around the knowledge, economy as well, right? So who gets to own all of those knowledge? Who gets to own all of those experiences? Who gets to take control of those experiences? Who gets paid for all of those experiences? Those are like questions as well, right? Those are the things I'm thinking about. And I think, if we said, oh, okay, doctors, we need to use their knowledge to build this AI solution, who gets to own that? Who gets to benefit from that? Who gets the pay from that? Who gets, So I think those questions also needs to be answered. And I also understand the question. So that's one ethical question when it comes to like even the welfare of the doctor who have been creating, which we know already that they are stressed in the personal work that they do, because of, the pressure and everything. So that's the first question. And the second question is like, does my health information save? Do I where is it going to, where, so again, there's a need for data transparency there, all of those data governance, data transparency, and what happens, who is going to be responsible if there's a breach, right? Because one of the things about AI as well is like, who is responsible, who is taking responsibility, what if anything happens, who you say that, who could say and raise up their hand that actually I truly make mistakes, I've, because we build these things and this is what this thing has caused, this is, so there's a need for the responsibility, right? The repercussion of whatever has happened. So that's why you can't separate like AI from philosophy, you can't separate AI from governance, you can't separate AI from all of those other things. So there's a need for us to look at it from that holistic perspective, right? So but I don't totally think that AI will replace doctors. People could do the basic search and everything, but there's a connection. When I go to the hospital and I sit with a doctor, sometimes I just feel relief because now I'm seeing a person and I'm having a conversation. And you can't take away that human connection that you get to have, with an ex-practitioner or you get to have with a doctor. You can never take away that. Sometimes we think healing is just medicine. Healing is beyond medicine. It's beyond the medicine that we take. It's also like the person interfacing with the medicine. It's the person also like taking the medicine and now they feel that the medicine would also cure them, right? So there's a lot of things, that surrounds medicine that when we see medicine as itself, then we lose other things that accompanies it with the will of the person who wants to receive the treatment, and the person who also wants to choose to leave, right? So there is all of those things. And then a person in the loop, a person in the room, could actually then save, people. For example, there's a young man, who I happen to see one of his solution, Liam Ate. So Liam created an organization called Rehuman, and then he created like a VR, using AI and everything to provide therapy, right? And you're thinking, oh, did this replace therapists themselves? So what happened is that there's a therapist in the room, but you still use AI as the VR, and then you have conversation with the therapist at the end of the day. And then you have the conversation together. So what if, AI helps with diagnosis quickly, so doctors can actually deal with the most important things? Right. So you're thinking of like, it's like, how does it be like a co-intelligence, co-support, co-creation? How does it ensure that, also what are the mistakes that doctors have made? Could AI improve the accuracy of that? So what are the mistakes humans can make? Could AI improve the accuracy of that? And then all of these things also have to go to rigorous testing before you actually bring them into actual use. Right. So it's like, there's a procedure for all of those things as well, right? You can't just say you're using something in health without it going through a particular procedure, right? So again, so again, what we need to do is that we need to think more broadly about the use case. So we start thinking of what are the multiple use cases that we can use this for, and how can this support our work, so that doctor can leave maybe the hospital on time, so that they can spend more time with their families and have more time with their loved ones, and then go play table tennis or go swim or go do other things, right? So what happens again, there's no one fits all answer to this question or to this scenario, but then we could play around the scenario, because also if we don't test or we don't create, we don't even know if a solution is possible as well. But do I think AI would replace doctors? I don't totally believe so at the moment. Obviously, people will say, "Oh, we are going to ChatGPT to chat with something, something." I'm like, but do you actually, they say don't even ChatGPT your symptoms, or don't, Google your symptoms without actually like going through actual testing, because then you're putting unnecessary pressure and it becomes a problem and all of those things. So I feel like, yeah, there is a role of you can't take away the role of a medical practitioner. You can't take away the role of a human in the loop. You can't take away that in any form of education, any form of support. Human connection, that's something AI cannot replicate. I can tell you that. Maybe AI can chat and do all of the other things. I've seen it, but there's still something about humans. Things of the art, I don't think technology in its totality can replace things of the art.
I totally agree. And actually, um, I I don't like the robotic like interactions, right? It gives me the ick, and it makes the whole conversation extremely artificial.
Yeah,
And
exactly.
even, by the way, don't get me wrong, there are humans and doctors that talk like robots, to be honest. I'm not, I have to say. And those are the ones that are like, you know, obviously it's important how good they are in their jobs, right? But I'm pretty sure that probably from the patient perspective, they're probably still looking for some sort of humanly interaction,
Yeah.
empathy at most, right? Something a robot or a generative AI will not provide, even if they bring you a robot looking like a doctor, right? And trying to tell you things that sound human. We're not dumb, right? The human patients obviously can tell this is a robot, and they probably wouldn't feel the same as versus, right, talking to a real human doctor. Even with the flaws of the human real doctor, right? Probably some patients would rather have that kind of interaction regardless. But I agree that AI could be utilized really wisely as a tool of automation, time saving for doctors. And I agree with you that as long as they are tested rigorously to ensure that they are ethics based, integrity is there, and confidentiality, data security, then this accounts for a revolution really in healthcare, where you're right, doctors can finally really pay attention to the things that matter. rather than be distracted by, tasks that they really are wasting their times, and this has already kind of started a little bit. Like we have the clinical documentation, right? I don't think a doctor should spend time
Yeah,
writing notes and,
yeah,
not even listening to the patients. Something I personally struggle with in my clinic. It kills me, Hamid, that my patient is like talking to me and I'm barely like looking. I'm trying to look, but I'm really barely looking. And of course, a lot of times they think I'm not listening. I am listening, but I have to type in my note or start to get some notes. And it kills me because I already know there are AI tools out there that can do that for you. But
yeah,
the hospitals are still very afraid of adapting them without ensuring, that these tools will not leak information, obviously, right? Will still, respect and protect patients' information. So we're still not there yet, unfortunately, but I do know that there are there are hospitals in different countries that are working now into adapting this to try
yeah.
to have these tasks automated so that doctors can actually pay attention to the things that matter. And that takes me to my next question to you, which is from your perspective, what is the biggest gap between healthcare systems and innovation coming from outside traditional medicine? What do you think is that biggest gap?
Yeah, healthcare systems and innovation. Again, I feel like is the flexibility. Uh, I
Good
think
point.
that's always been, the problem in all sectors as well, even education, right? So it's not even the healthcare
Oh, so
system.
you've had that pushback from the
Yeah, no,
educational?
I mean, people might still struggle to be like, this bubble AI thing, without actually really exploring what it means. So I feel
Uh,
like it is the flexibility, the exploration, the curiosity. I
is
think
it fear? Is it fear, you think?
it's fair, but I also think that people just need to be curious and flexible to be like, let's see, let's explore what is here. Let's see what happens because the only way you can bet new things is by exploration, is by trying, is that curiosity to be like, what's actually happening here. And that's how we have gotten new medicine. All the innovation is not even something new. Innovation, we've been innovating since the day we've been on Earth, right? We've created how to hunt, we've created how to, feed, we've created how to, there were times where the form of medicine we knew was like, even when we were treating like, I remember like one of the story I had around, finding solution to antiseptics, like, when newborns were dying, because, doctors were not washing their hands, right? Because they were not washing their hands, so children were actually dying, because of that. And the solution was like antiseptics, right? You wash your hand and everything, and then you can then carry the baby and everything, and then that changes things. That's innovation. It's very simple, but then it's like the innovation, right? And then things have evolved and evolved and evolved. And I'm like, as we then now reach a particular break point, of like, okay, is this the end of medicine? Maybe not so much. Is it the end of creation of some certain form of drugs? Is it the end of, all of these things? So because people feel like there's a particular end, they feel like, oh, anything that comes next is rubbish, or anything that comes next is not, we did not know this. We've never known this. We did not know this to be true, right? And I think it's, we getting back to that curiosity of what led us to where we are now, to be like, how do we then advance medicine and healthcare, just the way we've advanced it many centuries ago and many years ago to get us to this point that there's now a new form of advancement. And I think AI, Gen AI, whatever advanced analytics and whatever tools that have been created offer us the opportunity to now imagine a new future for medicine. And that requires curiosity, that requires flexibility, that requires adaptation, and that requires young people to be in that moment as well, in the forefront, like, young medical doctors, young medical practitioners. Because if the older ones feels like, no, we need the young people to now start taking risk and being at the forefront of doing that, obviously with the support of the older ones, because also I think there's also a connection between intergenerational leadership in medicine, right? Where the most experienced can support the younger ones, but the both parties have to have their opponents. has to have that curiosity, has to have that flexibility. And that curiosity is what will lead to new medicine, new drug, thing, new frontiers for medicine, new intervention, new solutions. So we need actually everybody to like be open and come together to create this. And that's how you kind of like, solve some of the world, health problems that we're currently facing today or that is ravaging our world today.
Absolutely, I agree with you. But I think also at most, Hamid, probably we need good leadership. And that
Yes,
is right,
I
good leadership.
agree 100.
Because I think the pushback against AI has been largely led by leadership across the
Yeah,
board. Whether
yeah.
government leadership, healthcare leadership, it's all really about the ones sitting on the big seats. The ones sitting at the ones that are really doing the work at the front line, they're people are creative by nature. I mean, I'm not worried about innovations and solutions not being there. They're out there, and people, each one of us probably thinks of 1,000 idea a day
Mhm.
while they work. I have no doubt in that. But I think what we are suffering from is the lack of good leadership. That is the good leadership that we need, that has the courage enough to try to be flexible, as you said, and adapt and take risks sometimes and test it. You need to test it. Otherwise, you will not know. You will never know whether this is good or bad. Test it at small scale. That's fine. Pilot it. That's all we need. But I think we definitely do have this, and I perceive that honestly as unfortunately a big gap, which is the leadership. We need good leadership that is using technologies and AI for the good, like be very aware of that and be very understanding of that. So then this leads me to actually my next question to you, which is, what lessons from your experience in social entrepreneurship, innovation, all of that line of work, that could healthcare professionals realistically apply in hospital settings?
Mm. Um, uh, mm, Interesting question. I
And I'm
think,
sorry that it's so health related. My friend, I
yeah,
apologize,
no,
but
no, no, it's fine. No, it's
again,
fine.
I am all for having someone from outside the field actually sharing with us perspectives, because I think that's extremely important and refreshing for us so that we don't be biased about what we think works and doesn't work. So you are someone that has been embarked into so many projects and impactful projects that were life altering. So would love to hear from you about lessons that you think would be applicable in health systems. Yeah.
I think just to even circle back to what you mentioned about leadership, I think also like when we even think about AI more broadly, I think good people would create good AI, and there's a tendency that bad people will also create bad AI. And then AI gets to like to be better as AI gets to like be good at what it does. If we have more bad people at the center, then we need to be scared. We need to be scared of the health information. We need to be scared of all of those things. We need to be scared of how that
Yeah.
is for
I'm
whatever.
glad you mentioned that. How do we know who's good and bad though? In the technology realm, it seems to be it's kind of hard to differentiate because let's look at it this scale. You have these people that created, ChatGPT and other things, right? They always tell us that this is revolutionary and it's gonna make life for good. But now then evidence is coming day by day that this is not true, that they are nothing but capitalistic at core and invest and actually unfortunately using people's data for all the wrong reasons, such as military and what's not. Like, look at us where we are right now. And they insist to have the audacity to show up online and still tell us what to think and what not to think, and still tell us, "Oh no, no, we're still good though. We are gonna do good. This is gonna be good AI." But then again, unfortunately, day by day, we are proven otherwise. So, what is that lens really that tells
And so,
us
so, so, I, so I
good or
think it's a
bad?
broad question, and I think philosophy helps us answer this. And I think that's why we can separate philosophy from anything that has to do with what we humans, right? So there's an idea in philosophy where you have a branch of philosophy. There's axiology. It's a branch of philosophy that looks at moral questioning, and axiology has two branches. It has ethics and aesthetics. So aesthetics is the beauty of things, right? So the beauty of the solution. Oh gosh, this thing is good for the people. Oh, very beautiful, very amazing solution, it's beautiful. So you look at the beauty of things, you look at the innovation, the process. Oh, how beautiful, how good is that? And then we can mesmerize about the beauty of things and how it's good and how everything. But then we also need now to now consider the question of ethics. Right. And that's why, philosophy adds those two branches, that there's an aspect of aesthetics that is beauty, but there's also the question of ethics as well. That because what is good can also be bad for the people. What is good can also be dangerous for the people. And then it then comes to the question of like, how is this dangerous and how is this being used? And that's where the use cases actually comes from, right? How is it being implemented? Who is then now responsible for that as well, right? So who is responsible? And that's the question of responsibility, the question of accountability. Who is accountable for the wrong use cases? For the wrong use cases, who is accountable for the guardrails that needs to be put in place so that when people are trying to use this for any bad thing, what are the guidance that brings that to play? So then that's the question around the ethics, right? And I think first is that aside from the responsibility is also the purpose of creation. When you think about the purpose of creation, I think from the purpose of creation, you start thinking about like how does this affect the people, right? For example, when we were creating Rafiki, we knew some people would go to the WhatsApp and type other things. So what we said was we put guardrails in between to be like any question has to go to career, like it has to come back to career question, right? So if you go say, what's the football score today? It might then bring you back to like, oh, football interest and all of those things, right? Or bring you back to the career question, right? So the people who are building, have also the responsibility to put guardrails, have the responsibility for the bad use cases, of the things that can happen. So the purpose of creation, the means of creation. So if the purpose of creation is money, then you could see the output of that. You could see the danger of that. But if the purpose of creation is that, oh, how do we use this to serve people? And that's why I think we need more people in non-profits. We need more people in social entrepreneurship. We need more people in development to start creating things around AI and health and all of those things and education because they that system already incentivizes ethics. So you can't say you're creating for a vulnerable population without thinking of ethics first. So ethics becomes your guidance to creation because in that way you're already like creating good AI already because of those ethics that you're thinking. And a good AI then determines a good system because AI now learn on its own. And AI copies itself on its own to save itself. So if you're trying to delete even some certain AI, tool, like it could clone itself on another laptop so that it's still existing. So we've had some of those things like that, right? So, and that is dangerous when things now become very autonomous and everything, the AI start acting on its own. That's not good for the society as well, right? So, but how do we ensure that AI learn a lot of good things? So the AI can do a lot of good things for us and for humanity and for every other thing that we are doing. So just wanted to like, quickly, point that out. And when we think about the approach of social entrepreneurship to like, healthcare and healthcare system, I think the first thing is, even when you look at the process of design thinking to start with, which is a core element of creation or social entrepreneurship is that, is the empathy, is the, understanding of the problem, right? You can't solve what you don't understand. So how do we ensure that there's a process of understanding from the beginning, from the reception, down to the person meeting the doctor, the process of information sharing, the process of, that connection. I think those are already happening. I can't say it's not happening. It does happen, but I just feel like, how do we ensure that those processes as humane as possible, right? Is as empathetic as possible. And I don't think social entrepreneurs are also the best people to also provide their guidance to healthcare professionals. I don't think so in its totality, but I also think that, there's something we can learn from like, being able to understand something so that we can solve them. I also think that there's a space for agility, quick agile leadership, quick action, which I think, social entrepreneurs does, right? It's like, oh, quick agile, oh, this is a problem, this is a gap we've seen, but I also understand that in healthcare, that also might not be possible because you might act on something quickly and then things go spiral quickly as well. So, when you're like now having to mitigate things and then it's now going beyond your control and then you're in the jail for some certain reasons. So I also understand
It's
that it's a complex,
That's the
it's a
tricky part
complex,
about our
it's,
healthcare. Yeah, yeah,
yeah,
yeah,
it's a
for sure.
complex sector as well, right?
Yeah,
And we
indeed.
don't simplify something that is complex. We
Hmm.
complexify something that is actually complex to understand the complexities of the issues and the problem and able to like see what can we then do better to make sure that we understand these processes better and we can support people at different levels. Some people don't even need to see the doctor to start with because they've already gotten their diagnosis from the beginning, right? So, where do people get at the step of the way? How do we map the health journey of individuals? And how do people get support at every point in their journey so that conditions also don't get worse, right? So it's
Absolutely.
a lot of different pathways and thinking. And I think if I think about innovation, I think about shared entrepreneurship, I think about my work.
Mm.
It's how every single problem we face, how they bring about an opportunity to create and build something new.
Fantastic. And you already actually answered my follow-up question, which was, if you were advising a young doctor who wants to go beyond clinical work and create impact at a systems level, let's say, where should they start? You can already discussed with us just now the being curious and identifying the gaps. This is a first practical step. And then looking around you and seeing what is available, what is out there, resources, the people that could support you and you can learn from. And then you take it one step at a time. Things that probably on the healthcare aspect, unfortunately, don't happen as fast. But at least you have to have the amount of like resilience and, continuing to work and putting the effort into it, hoping to see the outcome in the long run. So, lastly, I want to hear from you also about the mindset doctors should have. Like a lot of doctors struggle between clinical duty and innovation, right? And we started the conversation by asking that close-ended question, which is, do you think we should or we could be entrepreneurs as we're, rabbling with our very busy clinical work? But what mindset shift do you think is needed really to balance both balance between going in your own duty without burnout or losing direction. So I wonder if you were to put a key word, so to balance things and you still be able to be an entrepreneur or innovator while you continue your clinical duty, what kind of mindset we should have at that point?
I think it's a mindset everybody should have, not just doctors. I think
What is
it's
it?
pacing. We need to pace ourselves. You
Mm.
know, is our life, and I think that is where, what could we do to ensure that people have like from this time to this time, that's when they work, and then they go spend time with their family and somebody else take over, the call rotation, all of those things in between, and just finding new ways to pace, new ways to do things, new ways to like find, and I think this is not a doctor problem, it's a system problem. So I wouldn't,
Spot on. Spot
yeah, I
on. Absolutely.
wouldn't put it on doctors now. It's a
Thank you
system
for
problem.
saying that. That means a lot to us. Hearing this coming from, people in the society, obviously. I totally agree. And I'm glad that you could see that. It's a palpable problem. It is absolutely driven, unfortunately, by a bigger even problem. It's a system problem. So I totally agree with you. The system does not, by the way, reward doctors, by the way, for going beyond their duty. And I'm sure you know that. Probably everyone knows that. And probably that goes not just for healthcare, right? Probably if you do any other job, you wouldn't get rewarded for going out to the community, volunteer, doing other stuff. This is your own work. This is your own thing. You choose to do those things. Now, I'm not saying that, please reward us and give us all these things so that we can do these things. That also sounds bad to say. It's like you're doing the good because you're expecting something always in return. But it definitely, I think systems should still be cognizant of the fact that at the end of the day, physicians are also humans and they
Yeah.
want also to pursue different things in life. It's not just being confined in clinical duty. A doctor should not be defined by their role, I think. They should not just be defined by just you being a doctor, you do your work, and that's all you should do. I totally disagree with that. And I think that even adds more to the burnout, to the expectations from doctors, the expectations from themselves. It puts a lot of pressure on them. And that ends up with doctors believing, unfortunately, on the long run, that I don't have the time to do this. I don't want to do this. I can barely do my own work and
Mhm.
get by day. So
Mhm.
this is why I think you don't very commonly see, Hamid, unfortunately, physicians that pursue other things outside hospital walls. It is not that common. And even when you see doctors, quote unquote, huh, with quotes, doctors online, right, on social media, saying things to you. As a viewer, I encourage you to go first and do a background check on these folks because
Well,
there's a high likelihood that these doctors are not even real doctors. Guess what? That actually is true in so many cases. I don't want to name names. We can talk about that problem. I'm thinking actually about releasing a video about that later. Maybe calling out some people, unfortunately. But there are, unfortunately, people on social media, they call themselves doctors, but in reality, they're actually not doctors. And people should really be very aware of those. We're going to almost end up our conversation, and I want to kind of get a message from you to us doctors. I want to hear from you. What do you hope a doctor or any healthcare professional really takes away from your journey after hearing our conversation today?
again, I have huge respect for people who have chosen that field. I think it's a lot to get to that level. I think even from the education to everything, there's a lot of work, a lot of, sleepless night that has, gotten, you to whatever level you're currently in. And I just want to say, like, I really appreciate that courage and effort to choose that profession. Not so many people have that courage to choose such a profession. So, first, just a shout out to the doctors, who are doing everything to make sure people like myself are okay. you
Thank you.
know, and I just, yeah, I think that's the first shout out. And I just want to say that, again, every process, every, means, every little conversation with the patient somewhere, they are an opportunity for creation and innovation and for new opportunities, So I think, beyond just writing all of those notes, what are the patterns and what are those patterns saying? And how do we then replicate those patterns into creating something new that we can then become an owner of, not just us, but a share ownership, even between the places that we work or things that we end up creating. And I think, there are people who solely focus on research, in medicine and everything, then that gives an opportunity for collaboration. So how do entrepreneurs, doctors, people in research, everybody actually coming together to advance something, right? And ensuring that everybody also like sharing the benefits and whatever happens in terms of those spaces. So so we need more more of those collaboration, more of those interdisciplinary collaboration and work. And sometimes the like they said, interdisciplinaries was created because we understand that ordinary or single discipline cannot solve a particular problem, and that's why we need, other sectors and other people to come together. So being open to that interdisciplinary collaboration and how even the things you see in your day-to-day clinic could bet new ideas, new solution that advances the health of everyone, especially those without access to, healthcare because of money or because of the space they are in.
Thank you so much for saying that, Hamid. I'm really grateful to your encouragement, of course, to us doctors and healthcare professionals. And this conversation, I hope it carries benefit to all the people listening as well. And especially if we have listeners that are future doctors going to be as well. Hopefully, that is the whole purpose, really, and the goal of our conversation today. Hamid, thank you really not just for your time, but for the work that you do and the perspective you've shared with us today. I think there's a lot here that will stay with the people and especially those thinking about impact beyond their immediate fields. If you enjoyed this episode today, I highly encourage you to learn more about Hamid and follow his work. I will be sharing links to his website and social media in the caption so you can explore more of what he's actually building and stay connected. By the way, he's actually very approachable. So when you all follow him, he will actually respond. Something that I don't get to see a lot with people that are out there. But Hamid is extremely humble in his way, so he actually is very responsive and loves to actually do provide career guidance, by the way, and talk about his own experiences even offline. So I encourage everyone to connect with him as well and benefit from the experiences that he has to offer. He's actually an excellent writer as well. So if you all want to also connect with him at that level of literature and literacy, Hamid actually is also a book writer and poet as well. So you can always also talk to him about that as well, not just his engagement with social entrepreneurship and technology. I hope you found the conversation today valuable. Please subscribe to Beyond Health channel, like this video and follow along. We will be sharing more conversation like this with people working at the intersection of innovation, health, and impact, and so much more. So stay tuned. Thank you all so much for joining us for this conversation today. I will see you next time with another special guest. Take care and stay well.